How does the stimulant Adderall cause edema in the feet? I'm asking in cardiology because there's a chance the drug causes a problem in the heart or blood vessels. Once it sets in, if Adderall is determined to be the cause, is that a sign that the patient can no longer use Adderall? Has something been damaged permanently when edema occurs as a result of Adderall use? I'm the patient. I'd gotten by without using prescription drugs for supposed ADHD my entire life, but after a head injury and a lot of chemotherapy, unrelated, I became so stupid and forgetful that my GP thought Adderall was worth a try. That was after I gave myself a year to see how much better I'd get without intervention. Answer: not much. I like the drug. I ruminate less and get more done since I've been on it. I've lost some weight and kept it off, too. But if it's harming my health, I want off it. The feet thing started about 6 months in. 3 to 4 months ago, if I keep my feet elevated all day and sleep with them higher than my heart, the swelling is pretty much gone. If I sit in a chair to use a computer all day, they swell up again. Also, my feet don't look right. They're sometimes red, and the skin feels rough. My hands also seem a bit chubby lately, too. I've never had swollen anything, and handled chemo well. I had no lymph involvement in my cancer case, and the cancer hasn't recurred and wasn't expected to. Was that a question? Not exactly. I guess the main thing I want to know is, what does Adderall do that causes edema in some people? Secondarily, which people? i.e., why me?
Hello, this is Dr. Stan and I will assist you with your question today. I am board certified and I have 40 years of patient experience. I will be happy to help you today. I'm sorry you are having a problem with swelling. You seem to be blaming the Adderall for the swelling, yet, even though this drug has a lot of side effects, swelling, retention of fluids, is not one of them. Lower extremity swelling that reverses by elevating your legs is typically caused by gravity. Other causes, less likely to be reversed by elevation, is heart disease, congestive failure, venous blockage, lymphedema, excess use of salt, kidney damage and others. One possible cause related to the heart could be increased heart rate causing decreased blood volume. If this happens, then blood pressure goes down, person gets lightheaded and fainting may occur. So, long story short, there is another reason other than the Adderall for your lower extremity swelling. Since you feel good taking Adderall, there is no reason to discontinue the medication. Should you get overstimulated from its use, then slowly withdrawal would be required. Discuss this with your doctor before making any changes to your medication. I am available to answer any additional questions you may have. Thank you for allowing me to provide assistance. I hope your medical problems are resolved soon and you feel better. Thank you. How are you feeling today?
Hi, thanks for your answer. There is a mention of angioedema as a rare side effect of Adderall in this FDA document. https://www.accessdata.fda.gov/drugsapta_slash label/2007/0115220S040LBL.pdf. I realize that most people don't get rare side effects, but in my case I have always been in good health, and nothing has changed in my diet or my environment. In the FDA document, angioedema is a result of hypersensitivity, which isn't saying much. It might not be angioedema, and it might not be caused by the drug that can cause angioedema. But it was a discrete onset. One day I had a markedly swollen right foot, whereas the day before I did not. A few days later, it was both feet. Your answer is actually sort of funny. Lower extremity swelling that reverses by elevating your legs is typically caused by gravity. My question would be, why would gravity suddenly cause my feet to swell, when it had never done so before? What types of edema start with one foot, and eventually involve both feet?
Angioedema is associated with allergies and usually preceded by hives, so I doubt from your description that it is the cause of your swelling. Your initial description, if I keep my feet elevated. Swelling is pretty much gone. Sitting in a chair. They swell up again. This is caused by gravity and decreased venous flow back to the heart. The cause of this could be a change in cardiac status. May I suggest a visit to your internal medicine doctor for a Doppler study of your lower extremities for a start in your evaluation?
Oh, I see. That is very helpful. If you don't mind, could you say what change in cardiac status would lead to edema in the feet, and why a 55-year-old might experience it?
Right-sided congestive heart failure.
Thank you.
You are welcome.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.